How is mental health related to gun violence? Well, this can be very confusing and controversial, and I'm going to try to lay it out in a very plain and simple manner. Mental illnesses are diagnosed based upon standards in the Bible of mental health disorders. The Bible of mental health disorders is the DSM, and it's put together by the American Psychiatric Association. Now, when you look at violence and the relationship to mental health disorders, the agency that has studied this the most is the National Institute of Mental Health, which is part of NIH. NIH has created two categories of mental illness. One is any mental illness. For any mental illness, there's no increased incidence of violence, and there's no increased incidence of the person being a victim or a perpetrator. Now, there's serious mental illness, which are people who have problems completing some activity of daily life, either working or caring for themselves or keeping a home. These people are actually 3 times more likely to be a perpetrator of violence, and they're 11 times more likely to be a victim of violence. Any mental illness included 44.6 million Americans. Of those, 57% had not received any mental health treatment in the last year. When you looked at serious mental illness, that was 10.4 million adults, of which 35% have not received any mental health treatment in the last year. With treatment, the increased risk of gun violence goes away. In America today, mental illness is more common than diabetes. However, if you're going to get treated, it is more difficult to find mental illness care than it is to find diabetic care. So let me explain why I say that. In 60% of American counties, there is not a single psychiatrist. If you look at rural counties, 80% of rural counties do not have a single psychiatrist. Many of these counties are clustered together, so patients may have to drive through multiple counties to actually see a psychiatrist to get diagnosis and medical treatment. I think it is important to understand the difference between a psychiatrist and a psychologist. A psychiatrist is a physician that has done a medical residency. A psychologist is a PhD that has done possibly an outpatient clinical rotation. A psychiatrist, which is a physician, is the only person that can diagnose and prescribe medication. Psychologists are also important in that they provide weekly behavioral, cognitive, and other therapies. So when you hear someone talk about gun violence is related to mental illness, it is actually more related to our broken mental health care system. We can use the same public health approach to improve our mental health system and take care of those that have any mental illness or serious mental illness as a means to decrease gun violence.